another question that sort of came to mind as you were speaking earlier is that I'm kind of anticipating from the audience is, why should I care? Why should I care as much about catching COVID? I've already had it before. Maybe I've had it before twice. I personally am not immunocompromised, so I can respect why other people might want to take X, Y, and Z precaution and mask or open the window or avoid outside. But that seems like a lot for me in my personal life. So why, I'm going to get in my Uber with the windows up and it's only me in there. And obviously the driver's in there too, but I'm not
Yeah,
going to
people
care.
forget about that though, for real.
He or she can wear a mask, but I'm going to raw dog it. So what do you say to that group?
I mean, I have a lot of things to say. I think maybe this is the time to look at our map of our wastewater data, because I'd like to just talk about where we are kind of with COVID and what the glorious future looks like and how full of COVID it is. Okay. So this is based on wastewater data. And I want to give you some context to this beautiful map of these numbers are how many cases of COVID per day we have. And, you were saying earlier, well, we already had the flu and, so isn't this comparable to the flu? First of all, COVID is still kills a lot more people than the flu. Let's start there.
How many more? Can you give us a sense of like the proportion?
It's an interesting question. I will say this. So last year on death certificates, COVID was listed on the death certificate for 76,000 people, and the flu was listed on death certificates for 6,000 people. That being said, when the CDC releases flu death estimates, they take that number that's on the death certificate and they apply an algorithm to it, because flu deaths are underreported, because flu deaths can lead to heart attacks and other cardiac deaths, and flu deaths can lead to pneumonias and other bacterial infections that won't be recorded as flu. What's kind of funny about the fact that they do this is that COVID can lead to those things too, and actually more often leads to those things. So they're not applying that little formula to COVID. So they kind of like to say like, oh, well, 6,000 on the death certificate, but it's 20,000 that died of flu, or, they use their formula. They're kind of counting them very differently. So I'm just telling you what the death certificates say. COVID's still more deadly than flu. The other thing, though, is that COVID is so much more common than flu. There's not even a COVID season like there's a flu season. Like it is just going around all year. And these dips where it's coming down, that's when we get, these brief periods of immunity before there's a new fit variant that comes along and causes another wave. These variants evolve because of the unmitigated transmission. And as soon as one of the, dozens or hundreds of children of the current variant has the fitness to overcome the previous immunity, it starts to really take off, because COVID is very, very contagious, and there's nothing to stop it. There's nothing in the way. So if we're looking at this biobot data, wastewater data, around November 2021, see if you can find that on this map. It's like
there's a huge spike. It's off the charts, literally.
That's okay. So that's Omicron wave 1. That's about a year after the vaccines. That is the first reopening wave.
I see.
So many people died during that wave. And that's kind of the point where I started wearing a mask again, was because I was reading the New York Times, and during that wave, Dave Leonhardt, who's just like chief propagandist for Biden's abysmal COVID response, every single day he was saying, there was a 9/11's worth of people dying a day during this wave. And every single day he was saying, this is a good sign. This is a good sign. This is a good sign.
Why was it a good sign?
Because
to have that many people dying every day.
No, because, it wasn't as many as it would have been before the vaccines, basically, which was true.
Okay.
Okay. And the way that they reported it was essentially, deaths lag infections by 3 weeks. So the trick they did was that when infections started to go really, really high, they said, oh, deaths aren't high yet. That's because they lag by 3 weeks. And then when deaths went high, they said, oh, well, cases are low now. So they do that over and over again in every wave. If you pay attention, you'll start to notice it. Oh, well, cases are going up, but deaths aren't high. Oh, deaths are high, but cases are coming down. That's just the way the waves
just to
work.
be clear, just for context, what were the average death rates at the time of that November 2021 spike versus during sort of the height of COVID, the height of pre-vaccine COVID?
So February 2021 was the deadliest month of the pandemic. But so many more people were infected is the thing. So like the rate was lower. So like in these very early waves, I think it was like a 1% fatality rate, 1 to 2 or 3%. And that has come down significantly. But sorry, I'm kind of getting off topic.
So it was about, sorry, just to clarify. So the AP article from the Times said deaths were about 3,150 per day average in February. This is an article from February 1st, 2021. And then I'm going to go back to your chart. Oh, it doesn't tell me deaths per day. Per day, no.
That would have been similar. I think January and February 21 was about like, it was probably in the 2000s per day in January 2021.
Okay. I just try to see if I can pull it up real quick, but it's so difficult to find the news article from the time that you want to find it in. Okay. So I'm just trying to get some context to the gravity of the spike that we're talking about in November, which was the first kind of post-vaccine spike. Okay, go ahead. I'm sorry, I didn't mean to interrupt.
So actually the first post-vaccine spike is the one right before it. That's the Delta wave. You see that
in September?
Yeah. So in between Delta and Omicron wave 1, there's this dip right here. And during this dip, everybody was hoping that we basically were on the way down to like, maybe not eliminating COVID, but having not a lot of COVID in the community anymore. When, you can see where Joe Biden came into office in January 2021, see how this is going down, 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 down. This is where a lot of people stopped paying attention because we were like, okay, it worked. We got the vaccines. It worked. COVID's going away. And I think the reason a lot of people tuned out is that then when Delta hit, it was like, I'm not doing this again. Like I decided it worked and I'm not going to pay attention, basically. And so people were freaked out by Delta, but we were told at the time, look, this is just unvaccinated people and this is just a wave of them. And then we're going to be able to go back to normal. So in this little valley between Delta and the Omicron wave, Fauci went on TV in November 2021. And he said, he was asked, when can we go back to normal? When can we get this sense of normality back? When can we stop doing measures? Here's what he said verbatim. I think if we can get well below 10,000 cases a day, I think that would be a level that I think would be acceptable to get us back to a degree of normality. The headline on CNBC in November 2021, White House Chief Medical Advisor Dr. Anthony Fauci said Tuesday that COVID cases in the U.S. may need to fall as low as 3,300 per day for the nation to gain control over the virus. Okay, look at this chart. Since he has said that, not only have cases never once hit under 10,000 cases a day, they've never once gone under 100,000 cases a day. And during the peaks, they go well over 1 million cases a day. And the reason I'm up is that this is not the quote unquote post-pandemic that people were expecting. The people who made this decision to pursue this policy of a vaccine first herd immunity strategy, their strategy did not work. Nobody expected this. This is a ludicrous amount of illness. And this is not just about, who's dying, who's not dying. This is about everybody's sick all the time. That's what this represents. And, you're asking me, well, why should I care? What this chart represents is everybody getting a lot sicker all the time. And one of the things that I think people are at least somewhat aware of now is that long COVID is a risk of every infection. And perhaps that's something that you might want to take a gamble on if it were the kind of virus that you could get one time and then you're protected for life. Perhaps it's something you would gamble on if it were like the flu and you got it 1 to 2 times a decade, which studies show that is how often a healthy adult gets the flu. But people are getting COVID once to twice a year. This is a totally unsustainable rate of illness. And the reason you should care is that it is going to, in the long term, really mess up your health. We know that COVID affects the heart, it affects the brain, it affects the immune system. Every infection is not necessarily going to cause you lasting damage, but it could, it might. And a great way to find out everything COVID can do is to get it 20 times in the next 10 years, which, to be clear, is Joe Biden's plan for you.
Yeah. So I want to talk about long COVID. And I think when I asked why should people care, front of mind for me was long COVID, because I do think that a lot of people having had now, basically everybody having had experience firsthand with COVID, it can make you feel a lot more confident that it's less of a big deal. I mean, I remember, at the beginning, I happened to have been recently unemployed because the birding campaign was over when COVID started,
yeah,
right? So I was able to, and I don't live with anybody. I don't have kids. So like I could completely isolate.
Right.
And it was a long time before, after I started working, frankly, working at, being asked to come in and work at Rising, one of my biggest concerns was, oh gosh, well now I have to be maskless and on camera in a workplace sitting next to someone who has been very vocal about his disinterest in ever wearing a mask and who got sick all the time. I was out of work because he was sick all the time. And is this something I want to expose myself to? But I was in a very privileged position, right? So I felt like there was a high return on me masking, because there was basically, if I were was diligent in public, there's basically no other way I could get it, right? I was only exposed because I had nobody living in my house with me who had to be unmasked to their job. I was only exposed if I put myself in that position, right? If I didn't wear a mask in the elevator before I went out on a run, or I didn't leave my house very much that year, except for to go down in the elevator and go on a run. Okay.
Right.
But then, life, everything opens back up. Life is returning to usual. I'm going into an office place every day unmasked, and it starts to feel like, well, if I'm unmasked here, doesn't matter if I'm unmasked there. You see fewer and fewer people wearing masks. And it got to a place for me personally where I was basically only masking if I got into an Uber, or if I went to the airport, or if I sat down to get my nails did. But any other building I went into was basically, I'm out, I'm not really going into places, right? Like, infrequently, I guess maybe I'll pop into a store, like a shop, to, clothing store occasionally, or grocery store. I would mask in the grocery store. Yeah. But generally speaking, unless, it just felt like, occasionally I'd be out not planning to go anywhere, and then I'd pop in somewhere and I wouldn't have a mask on me. And that itself became normalized. And then, of course, restaurants are the big one where you're eating. And so the facade, like the fiction of wearing a mask when you're clearly about to sit all here together unmasked, chomping down. Like, why are we even entertaining this facade? Go ahead. I'm sorry.
I mean, I think you're describing why it's impossible to do a public health response of one. And this is why, this whole idea of like, well, you do you, like, if you don't want to do risk, then you don't have to get exposed. It's like, yes, you do. Like, there is no possible way for people to, there's so many exposure points. If you have kids in school, your kids are forcibly getting infected. Like, there's nothing that you can really do as a parent. That being said, these actions that we take, as leftists, as people who are trying to, be part of the community and end chains of transmission, they are more effective the more people participate in them. And I think that normalizing those behaviors is really critical. I mean, like, so if I go to a restaurant, I eat outside, and like everybody knows, like, if all my friends know, like, I always mask indoors. And if we're going to eat at a restaurant, we got to go somewhere that's outside. And like, that's it. It's not that big of a deal. I probably won't eat outside if it's a huge surge also, because it can spread outdoors. But, you gotta, I think,
Yeah, balance the risk reward. I mean, this is the
yeah,
problem. So the reason I walked through that was just to try to like unpack the psychology of how the interventions even someone
totally.
like myself took, because I was invested in this, started to peter away. And I do think that after I had my first infection in the summer of 2022, it sort of altered my kind of sensitivity toward it. It made me feel like, oh, well, now I have this period of immunity. So now I'm like being very cavalier in a way that I wouldn't have for immediately after. And then it's hard to get back on the wagon once you've gotten off the wagon. And so then I got my second infection over the summer. If you if you go back and watch the episode where I'm interviewing the remotely, obviously, the doctor who had just gotten back from, or who had gone to Gaza in April,
Mhm.
and you see that I'm very sweaty and that I'm wearing a sweater despite it being like July. It's
Yeah.
because I'm freezing and I'm having chills
Oh,
and my fever is breaking in the middle of that episode.
yeah. No.
So yeah, so I had my second vision. Then I started to kind of reevaluate what my exposure was going to be over a lifetime in the exact way that you described, and what is going to happen with my likelihood of long COVID, given the likelihood of getting infected every 2 years, which is now my record, right? So let's
Yeah.
talk me through long COVID and speak to an audience of people, some of whom might be skeptical that this is a real thing.
So long COVID, I think it can be confusing to some people because it can do so many things, so many diverse things. I'm actually going to read a little bit just because I think it's better to let the experts speak on this, from a paper, a really big review in Nature Medicine that came out really recently. So this is from Dr. El Ali's team. He's one of like the foremost experts in long COVID. It says this paper essentially found that long COVID is costing economies $1 trillion a year, and estimates the global burden of long COVID to be 400 million people globally. And El Ali has also publicly said, essentially that I think that government agencies are itching to pretend COVID is over and that long COVID does not exist. So again, I do want to reiterate, that when we're talking about COVID being a big deal, we're really taking this from the scientists studying COVID and the WHO, not from like fringe people on YouTube. These are the foremost experts that are looking at the impacts of COVID.
I will say, Julia, I do have to say, because I know that this is going to be what people are thinking, there are a lot of people who are very dubious about the World Health Organization for lots of reasons. Have you gotten this?
Go ahead.
Yeah, go ahead. I was just going to ask you, have you encountered some of this skepticism, and what do you say to folks who are like, well, that is the same way that because of the CDC's missteps, they're like, well, I don't know, I'm not going to hashtag trust the science because the science has been all over the place, and people like Fauci, to your point, have given advice that seems to be in line with business interests, the airline's interests, et cetera, as opposed to the public health interest.
Yeah, sorry. It's just a bit ironic because yes, the WHO is not doing anything. I mean, like they're saying one thing and they're doing essentially nothing because of those business interests. Like they're not, what they could do tomorrow is they could say, we recommend airborne infection control in all healthcare settings, and they will not do it. They put out a really big document recently that said, hey, we're not going to say droplet spread anymore. We realize it's not a thing. We're going to say airborne, like aerosol respiratory. They've made up a new term for it. But we are not going to change our recommendation, basically. So just keep doing what you're doing. Give people COVID if you want to. It's a really bizarre document. It only makes sense if you're looking at it through the lens of they don't want to tell people to spend money.
And by people, you mean like institutions, governments, corporations. They don't want them to have to spend money. Yeah.
Right. It would be a really, really massive, I think it also has to do with like, one, it would be a really, really massive expense, but also it is a huge embarrassment to the WHO. Like what they did was so damaging to their own reputation. And I feel like the reason so few people know about it is because they're so reluctant to like promote information that exposes that they were so wrong for so long. I mean, like all of the stuff they were advising, stand 6 feet away and don't sneeze on people and wash your hands and wear a surgical mask, like that, those are droplet-borne precautions. They do reduce spread. They didn't do nothing, but they should have been advising airborne precautions and they refused to do it. Anyway, so let me read about long COVID. Long COVID represents the constellation of post-acute and long-term health effects caused by SARS-CoV-2 infection. It is a complex multi-system disorder that can affect nearly every organ system and can be severely disabling. Several mechanistic pathways are implicated in long COVID, including viral persistence, immune dysregulation, mitochondrial dysfunction, complement dysregulation, endothelial inflammation, and microbiome dysbiosis. I don't know what that is. So I think there's this sense, and I don't think there's I think it's on purpose. It's deliberate that there's this sense that like nobody knows what long COVID is. Like it's just sort of people being tired. There's actually been a ton of research going on, and there are biological differences in the bodies of people with long COVID. It's just that COVID can affect so many organ systems that can manifest in a lot of different ways. Something I hear a lot is people will say, well, I don't know anybody with long COVID. The truth is you almost certainly know someone with long COVID. That person may or may not know they have long COVID. For myself, I developed new onset migraines after my COVID infection, like permanent, horrible migraines that I now have to take 3 medications for. And I think if we're talking about, being on the left and, trying to create a world that doesn't unfairly burden people and workers with healthcare expenses, it's like, well, I'm now paying for these very expensive medications and probably will have to like forever, because if I go off them, I get the horrible migraines again. I still feel lucky that like they're controlled. But that being said,
yeah. Well, I mean, one interesting asymmetry I noticed, again, an observation that came from like being on Rising and having kind of the left-right conversation about this for so long, was that there was a real sensitivity among kind of a right-leaning or independent audience to the health effects, the negative health effects of vaccines. So they would really hop on, not like wrongly, but they would really be focused on reports of young men in particular having myocarditis as a consequence of vaccines, even though the rate of myocarditis in that population was very similar to the rate of heart issues as a consequence of contracting COVID. And so yeah, go ahead. Sorry, go ahead.
I was just going to say it's hard for me to take some of the right-wing stuff seriously, because I do think, to use the name of your podcast, it's very bad faith in the sense that, like you were saying earlier, they don't care about controlling COVID. If somebody were to come to me and say, I'm really worried about the vaccine causing myocarditis, and that's why I also wear a mask in every public space, because I know that COVID causes way more heart issues than the vaccine, which is true, then I would care. But and there are actually people in the long COVID community who had, bad vaccine effects. Like, I'm not saying that doesn't happen. It does. It's just that the effects of COVID are much worse. In every study that they've looked at it, it's not that it's even, it's that it's much, much, much worse to get COVID. So if someone's saying, well, I just care so much about this like tiny population of people that had this elevated risk after the vaccine, then you should be doing everything on earth to prevent them from getting COVID, which is much, much higher risk.
I completely agree.
Yeah.
And this is, and let me tell you, this is a debate I had with Robbie 1,000,001 times. Hey, YouTube, thanks for watching. Just a reminder that this is a podcast. You can catch an extra premium episode every Monday for $5 a month at patreon.com/badfaithpodcast. That's patreon.com/badfaithpodcast for $5 a month, an extra episode every week. Additionally, please do consider liking this video, subscribing to this channel. It helps us out. It helps independent media beat the algorithm. We appreciate you. And as always, keep the faith.